Good morning, I'm Alexis Del Cid, and today we bring you an encore presentation of one of our very favorite programs. But before we do that, we want to encourage everyone at home to please be safe when it comes to celebrating the 4th of July. Our emergency departments treat dozens of patients every year for burn injuries. We recently caught up with Dr. Brian Beaver.
Certainly we want everyone to have a enjoyable and safe 4th of July, enjoying all the food and the festivities. When kids are using fireworks, number one, they've got to be supervised at all times. Fireworks are an explosive device, or they burn at very, very high temperatures. So we want parents to be right there, especially with things like sparklers. Sparklers are often seen as a safer alternative, but those burn at about 1,000,000 degrees. So it's really not. Every year, unfortunately, we see kids that get burn injuries on their hands, their face, from those sparklers.
Dr. Beaver recommends having a water source near you if you're setting off fireworks, like a hose or even a fire extinguisher, and to have a first aid kit handy. Happy 4th of July from our entire team here at the health system. Until then, enjoy this encore presentation and make it a great day.
If you have a lot of problems, it will give you your life back, and I recommend it.
Giving hope and a fresh start to a woman whose heart wasn't beating properly. We'll show you the device that provides precisely timed electrical pulses to her heart, and it was implanted quickly and simply. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. It's two words no one wants to hear together: heart failure. But your life doesn't have to stop when you're diagnosed with chronic heart failure, which is a good thing because the American Heart Association finds about 6.5 million Americans have heart failure right now. Heart failure is when your muscles, the muscles of your heart, aren't pumping the blood as well as they should. It can cause chest pain, shortness of breath, dizziness, fatigue, and sometimes indigestion. And when you have heart failure, a transplant is not the only option by a long shot. There is a new FDA-approved treatment, and the woman you're about to meet says it's incredible.
Well, I don't know. We guess we could go shopping. It's amazing. It's basically a miracle.
Jean Martin is in disbelief that the tiny device in her chest,
It's right here. It's an unusual device.
can do so much.
It lets me go anywhere and do anything I want.
It's called a CCM device, which stands for Cardiac Contractility Modulation. Located just under the skin below her left collarbone, the CCM delivers electrical impulses to Jean's heart, stimulating it for several hours each day to keep it beating properly. Jean says she hardly remembers it's there until Saturday mornings.
Saturday mornings is my charging morning. I can do it in bed, or I can do it sitting in that chair watching TV. It's there to do a job, and I have to help it. So once a week, I give it a little jolt, and we get along fine.
And Jean is getting along just fine, but it was a rough road leading up to this point because for quite a while, Jean put caring for herself on the back burner.
My husband wasn't really well, but I was busy with him, and I would get up in the night and have indigestion, and I'd walk around and burp until I got room, and I would go back to bed. I did that for probably a year or so.
After her husband passed, she finally made a doctor's appointment for herself.
5 seconds into the stress test, they stopped it, got the doctor in there, and they sent me over to the hospital.
That indigestion had actually been a sign of heart failure. In addition, Jean had multiple blockages. She needed a quadruple bypass surgery. She had it done at the University of Kansas Health System.
The whole staff, the nurses, the doctors, they're wonderful. I recommend them to anybody, anywhere.
About a year after her surgery, it was time for a second procedure to implant the CCM device to further improve her heart function.
Oh, as soon as I got out of the hospital, I got home, I felt fine. I didn't have any downtime at all. I hope the doctors realize how far they've come on their education, because it is a miracle what they're doing with the hearts already.
In fact, Jean only has one complaint, and she's not going to let this one go.
The only thing that I have to complain about is Richard. He's with the CCM group. He made me wait for him to come in and see me, and I hadn't had my coffee yet. So I give him a bad time every time I see him. I'm still waiting for my coffee. If I'm in the hospital, by God, bring me my coffee.
Jean Martin joins us in studio today, and by God, bring her coffee. Stuart, we have a delivery for you, Jean.
Oh, right.
Your coffee.
It's a beautiful day in Kansas.
Compliments of the chef. You like it black, right?
Perfect.
There you go.
Very perfect. I give Richard a really bad time. He was busy that morning with another fellow, trying to get him taken care of. He wasn't just sitting in the corner.
We know.
So, but it took a while. I was ready to go.
Yeah,
you get done and you're ready, but you can't go until the doctor gives you the blessing.
And you need your caffeine.
And it was like, I'm going to hurt somebody.
Right. That's very human.
Yeah.
The urge to hurt somebody without your coffee. So we want you to have a good experience.
Yes.
So now we're good. Here's to you, Jean.
Thank you.
Cheers to coffees. Doctors,
Cheers.
we got water for you.
Yes.
We figure you're all caffeinated up. We are so happy to have the doctors as well with us. We have electrophysiologist Dr. Seth Sheldon. Thank you for being here. And heart failure and transplantation cardiologist Dr. Taryn Dahlia. Thank you so much for making time to join us. Jean, how are you feeling today?
Great.
Wonderful.
I'm on the road. I'm a busy girl. I don't have time to just sit around and wait.
Well, we could tell you, well, let's get to the busy girl part. You play the bongos in a drum called the Meerkats?
Yeah.
Okay, I don't know where to start with this. First of all, how did you form the Meerkats? Where do you play?
I live at Mission Square, and it's a 55 and older community, and it's a wonderful place to live. You don't have time, unless you want to, sit around. There's always something to do. And this fellow that's in charge, he kind of attacks you when you come in. You want to play in the band? All you got to do is count to 4. Well,
that's how you learned bongos?
Yeah.
Okay.
You know, it's called the Meerkats. We're not dead yet. And it's just a fun thing to do.
So you're just back to living life and living life to the fullest.
Yep.
It was pretty immediate after you had your CCM device implanted. How quickly before you felt like everything was absolutely back to normal?
Pretty much immediately. I said I was a very busy person at one point. I went to the Powell Center for water aerobics twice a week. I went to chair yoga twice a week. And then I did the band once a week. And there wasn't anything holding me back. Nothing.
That's great. That's what you want to hear.
Yeah. Well, it's amazing. If you want to just sit, you can do that. But you're missing out on what you got. You
All the
got
good
another
stuff.
lease on life. So
That's right.
grab it. Go. That's what I did.
It's a fantastic message and a testament to how well this works. And Dr. Dahlia, we have some video showing how the CCM device works. It's an illustration. So do the electrical impulses retrain your heart to contract properly? How does that work?
Very well said. I think it's said right. So as Jean said, it's a miracle device. It works at the cellular level. It basically helps in calcium remodeling, and it's very timed impulses in a particular part of cardiac cycle. It helps in contraction of the heart without causing arrhythmias. It helps in basically strengthening your heart, in other words, and also help in relaxing of the heart. So it helps in heart failure both ways, by improving the contraction and also by relaxing the heart. And that's what's led to remodeling of the heart later on and improves heart failure symptoms.
Dr. Sheldon, how is it different than compared to a pacemaker?
Excellent. So the lead that's used for this is similar to a pacemaker, and the device is actually similar to a pacemaker. But what is happening with a pacemaker, we're stimulating the heart at a time where it's electrically susceptible to that stimulus.
So we have some show and tell if you want to hold up each one.
So this is what the CCM device currently looks like.
Okay.
So it looks very similar to a pacemaker that's next to it here. And then this CCM device would have 2 wires that insert into the heart and attach into the septum between the right ventricle and the left ventricle, the 2 main pumping chambers of the heart. So a pacemaker stimulates the heart or paces the heart at a time where it's ready to receive that stimulus. The CCM device actually happens after it's already been electrically stimulated, but it hasn't recharged yet, and affects how the heart recharges itself and makes it more efficient.
So we showed you the implant, we showed our viewers that, and we showed the illustration and what it looks like now. We also have this really cool video. It's a scan showing what it looks like when it's inside of Jean's body. Now this isn't Jean's scan, but Doctors, what kind of scan is this, and can you explain what we're seeing as it rotates?
This is called a fluoroscopy image, so it's basically like a fancy x-ray. It's like an x-ray movie, essentially. And so you can see the heart stimulating and moving these wires in the midst of this x-ray image. And we use these types of images when we actually implant the device to make sure we put the wires into the most appropriate location.
And the device, for our non-medical viewers, which is a lot of people, the device isn't moving in that video. The scan is moving around the body.
Correct. The scan is moving, and then the wires are moving because it's adjacent to the heart.
Jean, can you feel it when you press on your chest there? How close to the surface is it?
Oh, it's right there. And sometimes when I'm getting ready to charge, I have to kind of, where is it? To put the paddle in the right spot so the lights all light up. It's not invasive. It's just
there.
Yeah.
And it helps you, it enables you to live your life the way you want to live it.
Exactly.
Dr. Dahlia, part of your job is to screen candidates to figure out who is a good candidate to have this. What are the criteria that someone like Jean would need to meet to get the CCM device?
Excellent question, yeah. So I see a lot of heart failure patients. So for the CCM device, patients who have reduced heart function between 25% to 45% of ejection fraction, and they are on medical therapy for heart failure. Despite that, they keep on having symptoms of heart failure like shortness of breath, leg swelling. Those are the patients I look for screening for CCM device. And then there are other criteria which people meet for different devices, but we try to make sure that they don't fit those criteria. So these are the main symptoms, I would say.
When you're charging, Jean, can you be doing anything while you're charging? Can you be drinking your coffee, watching TV? Is there anything you can't do while you're charging?
Getting up, walking around is a little tricky, but you can do it. You just hold on to the one device and put your hand on here. You can go and do whatever. It's just easier to just stay put. And it takes 45 minutes. You can do anything.
We have the charger. While I'm asking you questions, Dr. Sheldon, would you mind holding it up? So that's the paddle. And do you want to slide it over to Jean?
She can show
us how you do it.
Since I'm not used to charging it.
So you have one of those at home.
It's a little different, but this is different than that. But you just put it under your shirt in the right direction over the device. Hit the button when the lights come on, and you're ready. You're go.
Now, where does the blue thing plug into? Does that plug into a wall? Is there a cord there? So what charges that?
You charge this separately.
Okay.
There's a charger like your cell phone that you plug this in and you do it. Okay. I always charge on a Saturday. So on my phone I have a reminder that says charge CCM. So I check to make sure that this is charged. I plug it in, and the lights tell me that, okay, it's charging. And in the morning, it's ready to go.
That's really cool. What would happen? Have you ever had a power outage? Do you have a backup cord or anything like that?
Never. I was at a heart appointment one time years ago, and the gal there's really super, and she was asking about the device, and I said, I charge every Saturday because I can't remember. So I've got to have it set
and ready to go.
So I don't have to think about it every Saturday morning. And she says, I had a patient in here that never charged this.
What? What happened? Really?
Yeah. And I'm going, really? I can't believe it. It's so simple. It's so easy to do. It doesn't take any time at all. It's like brushing your teeth.
Yeah,
you got to do
it.
Yeah. And if they took the time to do this, then I should take the time to do this. It's simple.
I see both doctors vigorously nodding their heads because something doctors always say is the patient is 50%. Patient compliance is 50% of the success rate, right?
Part of the puzzle.
But I don't understand how somebody could go through something like this and not pay attention to what they need to do. I don't get it.
Mm-hmm. But you're doing it.
I am, because I've got things to do.
I love that. Like the bongos.
Yes, exactly.
Like the bongos, which I love that picture. We were so tickled when we saw the pictures you sent, and I said, wait, she playing the bongos with the meerkats?
Yes.
That's amazing.
That's me.
Now, can you feel the implant in your chest when it's stimulating your heart contractions? Does it feel like anything?
No. It just does its job quietly and lets me do my job.
That's beautiful.
It is.
What a great,
It's a miracle.
And when you're in the water, you can go back to your water aerobics and
Yeah.
everything like that.
Nothing stops me from doing what I want to do, unless I fall down.
Right. I feel like nothing stopped you before either
No.
until you got sick. Kind of the unstoppable gene.
Well, you know, I'm 83 years old, and I have a gift, and I'm not going to waste it,
Right.
bottom line.
So well put. We have some great questions that are already coming in from our viewers. And if you're sitting at home watching and you have a question for the doctors or Gene or a comment that you'd like to share with the program, you can send it to us right now on YouTube, Facebook, or the All Things Heart email. All the links on how you can connect with us right now in real time are there on your screen. So Gene, can you take us through what it's like on Saturday mornings? You wake up, you know it's your charge day. What do you do?
Get my coffee,
Got to have that coffee.
grab my device and my coffee, sit in my chair, get all set up. 45 minutes later, put everything away and go on about my day.
And 45 minutes is the time they tell you it takes, or does something beep?
No, the machine tells you. You don't have to think about anything. It's all laid out there for you. You just hook up, and that device says you're done. The lights start to go off, and you leave it on until the last light goes off, and it kind of beeps, and you take it off and get ready for the day.
What would happen if Gene forgot to charge it, Dr. Sheldon?
It would deplete the battery much quicker. So this battery will hopefully last many years with appropriate charging, but it can shorten it dramatically if you don't have the charging actually happening once a week. And I would consider it, you know, for patients to be able to have a device that charges, it's almost a privilege because a lot of our cardiac devices don't currently charge and require a surgery to replace it. And this extends the battery life so long, it's really nice to have that option.
How long then will the battery last?
I don't know the specifics for her situation, just how much energy is required from the device, but hopefully somewhere in the range of 10, 15 years at least.
But that's amazing.
Yeah.
10 to 15 years. That's what you want to hear.
That's awesome.
This device, you started implanting it in patients in 2019. So how common is it now to use in your patients?
It's a device that's seeing increased volume over the course of the last few years, but it's still not that common a device. We still mostly utilize this for patients that are having symptomatic heart failure, and so they're restricted in their quality of life, and we use this device to improve quality of life. So it has specific criteria, like Dr. Dahlia mentioned, but we're also looking to test this in patients that don't meet those conventional criteria. So we have research studies looking at patients that have heart failure and normal pumping function of the heart, as well as a combined defibrillator CCM device.
That you can charge
Yes.
at home.
Yep.
Wild. And that is, it's
amazing.
just,
Absolutely amazing.
as you said during the interview, you are still stunned at what medicine and technology can do for someone.
Well, I'm sitting here because of what they've learned, and it's absolutely a miracle. Going back to when all of this started, the amount of education that these folks go through and what they learn, I'm just fat, dumb, and happy here.
Dumb and happy.
Yeah.
That's a good way to feel. That's a good way to be.
it's
You're not
awesome.
dumb. You're very clever. You're very sharp. We did learn a number that was so surprising to a lot of us on our team here. In just 5 years, more than 8 million people are expected to have heart failure in America. That's 1 out of every 33 people by 2030. That sounds like an awfully big number. Dr. Dahlia, are we getting better at diagnosing it, or are more people developing heart failure?
That's a good question. I think there's multiple ways to answer that. I'll probably say that with advancement in technology also, we are treating more patients with, let's say, somebody comes with heart attack. We're able to treat them and save their life. They also then become a chronic disease, then they have heart failure down the line. We're also getting better at diagnosing heart failure, but we can also see this surge of increase in chronic diseases, which can ultimately like hypertension, diabetes. We're getting better at treating them, so we are going to increase the population with heart failure down the line. I think so it's a combination of better diagnosis, getting more of chronic diseases, and more extended lives leading to heart failure. So that's why we're seeing increase and surge in heart failure patients.
So there are a lot of people watching just would love to know, okay, how can I avoid this? What would be your best advice to someone watching that's worried about their heart health and wanting to avoid that?
Yeah, so there's a lot of factors that can contribute to risk for heart failure. I think just taking care of yourself is important, and probably the #1 chronic disease that can lead to future heart failure is high blood pressure. So being on top of your blood pressure at an early age, if it's elevated, modifying your diet and regular exercise, not smoking. These
Smoking's
are kind of
a big one,
more
right?
simple things that can really help your long-term health, and probably limiting alcohol as well.
Bummer.
Do you enjoy a glass of wine?
Oh,
Meg?
yeah. Yes,
Yeah.
I do. We have happy hour at the place every day at 4:30.
I mean, you got to have some hope, right? Some joy.
Yeah.
I will say moderation is good if you have
Yeah.
Moderation. I got it.
We do have some great questions coming in from our viewers. Lin Yang Ling wants to know if the operating mode of the CCM machine is the same as that of a pacemaker, or are there any differences between the two?
Yeah, major differences between the two. The CCM device does not function as a pacemaker, so it's not able to overlap with a pacemaker and has to be used in addition to a pacemaker if somebody required pacing. And it's applying energy at a much higher energy level than a pacemaker is, so it's actually doing something different within the heart.
Is the CCM device something someone can request to be evaluated for if they're watching right now?
They can.
And they already have a
but-
pacemaker, or would you say leave it alone?
Yeah, it depends on, so a normal ejection fraction is, 55 to 70%. And this is for patients that have a reduced ejection fraction, so 25 to 45%, and then they have to have significant symptoms related to the heart failure as well.
Vera McLeod has a question. She wants to know, would this device be used for bradycardia? And if you could explain to our viewers, what is bradycardia? Dr. Dahlia, you want to take this?
no, actually, as Dr. Sheldon mentioned, that this is not a pacemaker. So it will not function as a pacemaker, so you should not use the device for bradycardia. If you need something for bradycardia, it'll be like pacemaker.
And what's bradycardia?
Bradycardia is a heart rate which is less than 60 by definition, but there are specific criteria for those who need pacemakers in those
Got it.
settings.
Ruth Ellen asks, does this potentially replace the need for a heart transplant in patients?
Oh, so I can take that question.
Yeah.
Yeah. So heart transplant is it's a whole together different game. We talk about heart transplant patients who have end-stage cardiomyopathy. So we are trying to prevent that from happening. So CCM device, by the way it works, can actually make your heart symptoms better, maybe improve your ejection fraction, can delay the heart transplant. It doesn't mean that if somebody has a CCM that they will not get a heart transplant. Despite having the device, you can still have progression of the disease in some patients because maybe they have bad heart disease that will end up being in end-stage heart failure, then they will need a heart transplant. But our goal as a cardiologist is to try to prevent that from happening. So whatever tools we have, medications, CCM devices, which we can use to extend their own native heart, we use that.
And that's what's working great
Yep.
for Jean right now. Lin Jinghong wants to know, will the CCM machine be affected when taking a shower? What happens if it gets sprayed with water?
Nothing. Absolutely nothing. It's there,
Yeah.
but it isn't. It's not a dangerous thing at all.
It's under the skin.
Yeah.
You just can't.
Your life has not changed a bit, other than you've got this device. Nothing has changed.
It's so cool. Leslie has a question for you, Jean. Were you hesitant or nervous to get the implant?
No. I was in a place where I knew I was in trouble, and I have the fabulous heart department here at KU, and the doctor I was working with at that time, she just said, well, there's a new device out. Would you be interested? Like I said, fat, dumb, and happy, let's see what it is. And she explained it all. And she said, and sometimes when you get this device, you also have, you got this on this side, and then you have a defibrillator on this side. And I'm going, well, if you think I need it, let's give it a shot. But I would just like to do the one, not both. And she said, well, let's see how it works. Mm-hmm. And it's working just great.
So if Jean had done the CCM and then needed a little something extra, you could put a defibrillator on the other side, or a
Yes, a
defibrillator or a
defibrillator.
pacemaker? What would you-
Pacemaker.
It's a combined,
Yep.
the other device would be a combined pacemaker defibrillator, which can be put on the opposite side of the chest.
Okay. And so you could have one here and one here?
Yep.
It'd be like the bionic woman.
Exactly.
Would you
Well,
be
go through the airport and see what happens.
Okay, that's a question that we have from someone, one of our viewers, that is coming up.
Nothing.
Do you have to carry a little card with you to hand to security to tell them?
No, But when I go up, that's just because I'm a nervous wreck. I like this thing, it does a good job, and I don't want to break it.
Right.
And I will say, I have, and I will say a defibrillator because they don't know CCM.
Right.
So then they take whatever precautions that they think, but they say I could walk right through that and not have a problem. I just like it, and I don't want to break it.
Right. Has one ever broken? Could you break it? What could, okay, let me take what, could she break it?
I
Is there
don't
anything she could do?
encourage trying to figure out a way to break one of these
Right.
devices. That
No.
may not be advisable, but through routine life, you should not break one of these devices.
And do you ever have questions like that? Do you ever have daredevils come in, skydivers, or people that you advise, don't?
Not yet. Not yet.
Not yet. Marie wants to know, is it possible someone could get a CCM implant and eventually no longer need it?
It is possible that people can have significant improvement in their heart failure over time, particularly with the advances we've had in medical therapy and other device therapies. At the same time, once you have one of these implanted, if it's been in for many years, they grow into the blood vessels and grow into the heart. So we may not necessarily
really?
remove it in the future, even if it's not having the same benefit that it did originally.
It grows into your, like the skin would encapsulate it, or it actually
The
becomes
blood
part
vessel
of your...
wall oftentimes kind of surrounds itself and kind of scars into place and grows into the blood vessel wall and then grows into the heart.
The body is such an amazing thing, the way it copes and
It is.
adjusts to things. Jean,
Miracle.
do you have grandkids?
Yes, I have 3.
Do they like to touch it
They're
and ask
all
you
adults.
questions? Oh, okay, that would be weird.
Yeah, they're all got adults. I've got 2 great-grandchildren, but they don't pay any attention.
Even when you're charging, they're not curious?
No, because I've never really charged in front of them, and no reason. They just weren't there when it was Saturday morning to charge, and I religiously charge every Saturday morning.
Well, we are so glad that you are here and that you do adhere to all the rules. Really, I mean, nothing could make these doctors happier than having a patient.
I want to keep them
Like you.
happy because they keep me going.
That's right. That's right. These two. As we wrap up this discussion, I would love some final thoughts from our guests, and I do want to start with Jean. Jean, you went through so much, starting with thinking your indigestion was stress because you were going through a tough time. What do you want our viewers to know that are sitting at home?
I was sitting in Iowa, walking around the living room at 0 dark 30, burping, trying to get the pressure off of my chest. And my husband had some problems, and I was dealing with that. But I'm one of these people that are I can tell you that I had Chinese or I had pizza, something that caused me to have indigestion.
Right.
Rather than think I'm having a heart attack. I will make up something. It can't be a heart attack. Well, went to the doctor, and I really got a lecture from him.
What did they say?
Oh, why didn't you come? And I said, it was indigestion.
Right.
You know, I don't think you should come to the doctor with indigestion. I said, besides, I didn't have the pain in the jaw or the arm.
Oh,
And he said,
wow.
that doesn't mean everybody has the jaw pain and the arm. Everybody has their own symptoms, and you just need to pay attention to your body. So I went and got the test, and then I ended up here with these guys.
Well, we're very glad you're here.
I am too.
Thank goodness. I'm glad that doctor gave you a talking to.
Oh boy, did he.
That's so good, though, for other people watching to know, to not ignore those signs.
And you might think, oh, it's silly. I don't need to go see the doctor. It's just indigestion. It's not silly. You need to go. You need to check it out. The doctor won't give you a bad time if it's silly.
Right.
Just go. Your heart depends on it. So.
Dr. Dahlia, what would you like to add?
Yeah, so I'll say, well, don't get scared with both words together, heart and failure. We have a lot of therapies now, as we talked about, like medical therapy and then devices and then advanced therapies like LVAD and transplant. If you're somebody who's struggling with heart failure, there's no harm in seeking expert advice or coming to see us in the clinic. See what options you have available for the treatment for the heart failure.
It's really nice to hear, get the impression heart failure can be something you live with and you just keep going. Like Jean, she's got it treated and she's playing the bongos and doing her thing.
Well, there's no reason to sit by and watch your life go by. It's
Right.
ridiculous. Grab a hold of it. These guys gave you a second chance. Don't waste it.
Dr. Sheldon?
Yeah, so I first of all just want to thank Jean for bringing more awareness to this device and being such a good advocate for this therapy, and thank you for having the courage to join on the show today.
My pleasure.
I think this is a device that has a lot of utility for a lot of patients, and it's significantly, I think, underrepresented in how much we utilize this device.
Right.
And so I think a show like this and a patient like this who can advocate for this therapy is a very helpful thing.
And it's great to spread the awareness.
Well, we say to people that you have a CCM, and they go, what?
Sure.
So it's a pacemaker? No.
Yeah.
It's something wholly different, and it does a different job, and it works.
It does it well.
Yes.
Thank you so much for coming on the show today and for being willing to
you.
share your journey, Jean. You're a delight, and we're so happy you're here.
Thank you.
Dr. Dahlia, Dr. Sheldon, thank you for making time. We know you have patients to see, so thanks for making time with us to spread awareness.
Thanks for having us.
And thanks to our viewers as well. If you'd like to watch or share any one of our previous episodes, all you have to do is scan the QR code on your screen right now. It will take you to links of all our past episodes.